Welcome. My name is Associate Professor Charlene Kaler and I am the Deputy Director of the Marshall Centre. At the Marshall Centre, we have many groups researching some of the most important issues facing the world today. Pandemics of infectious disease have shaped the world as we know it, from the Great Plague in the 1600s to the polio and Spanish flu epidemics of the 1900s. More recently, we have seen epidemics such as Ebola, Zika virus and now SARS-CoV-2 resulting in large disruptions to human society. Less well understood have been the epidemics affecting the food industry, including African swine fever, a rapidly contagious and fatal disease of pigs, which is considered a massive threat to global pork production. More recently, this year, a novel rapidly fatal flu in birds, H1N8, has arisen in the Northern Hemisphere and is steadily circulating around the world. These are just a few examples of the many emerging infectious diseases that will continue to arise more rapidly in our industrial farming sectors and across our societies. Tracking infectious agents can be difficult as it requires rapid and sensitive testing of samples from many sources. At the Marshall Centre, we have many projects working on the creation of novel technologies that will enhance the rapidity and sensitivity of detection of infectious agents. The following statements will introduce each of our program leaders and their projects at the Marshall Centre.
My name is Mark Nicol. I've worked at the Marshall Centre for the past 3 years. Our group studies respiratory tract infections in children, particularly pneumonia and tuberculosis. We try to understand how interactions between bacteria and viruses in the child's microbiome result in these infections, and also in the development of improved diagnostic tests for tuberculosis. Our group's work has contributed substantially to the worldwide implementation of a range of new diagnostics for tuberculosis. It's been cited in many international guidelines, including several World Health Organization guidelines for tuberculosis.
Hi, my name's Elma Fulleria. We're doing research at Biotome, a startup affiliated with the Marshall Centre.
And I'm Samuel Lundin. Our research is focused on precision immunology diagnostics for infectious diseases. We founded the company Biotome a few years back to make sure that our academic research results would be used in healthcare to benefit patients. At Biotome, we believe antibody tests can be improved. The current technology for antibody tests, or serology tests as they're called, is based on an outdated view of how the immune system works. The immune system is highly accurate and precise. It's like a camera working at a very high resolution. But current antibody tests are like taking this high resolution camera and putting a fuzzy filter in front of it, so the image gets very imprecise. We're using precision immunology, basing our diagnostics on so-called linear epitopes, which means we can create highly accurate diagnostics that provide more information. And this is in line with the current movement towards precision medicine and personalized medicine.
Our projects focus on a range of diseases where our technology can have impact. In our first project, we created a diagnostic for stomach cancer risk. Stomach cancer is caused by the bacterium Helicobacter pylori and is the third most common cause of cancer death in the world. Our second project focuses on SARS-CoV-2 infection. High accuracy antibody tests are needed that can differentiate between antibodies caused by a vaccine or those caused by natural infection, and that can distinguish between the variants of concern. Our third diagnostic is for preeclampsia risk. Preeclampsia is a major cause of mortality in pregnant women and affects around 5% of all pregnancies worldwide. We're also just about to embark on a project to develop a point-of-care diagnostic for sepsis, another major cause of mortality. We're very happy to be affiliated with the Marshall Centre and watch this space for our progress.
Hi, I'm Associate Professor Christopher Peacock.
I'm Dr. Kalila Santos.
We're interested in studying parasites and fungal research here at University of Western Australia. These are eukaryotic pathogens that have complex interactions with human hosts and as such are often very difficult to treat.
In the past years, we have worked on parasitic diseases such as leishmaniasis and schistosomiasis, including epidemiology, drug and vaccine investigation. These are predominantly neglected infectious diseases that affect the very poorest in society. We are interested in monitoring the presence of such diseases and potential vectors in Australia, examining how they cause disease and ways to reduce impact in human health through basic research.
Some fungal pathogens can cause serious diseases, especially in those who are immunocompromised, in a way that we're often extremely difficult to treat. One example is Candida auris, which is frequently associated with bloodstream infections and has a very high mortality rate. We're looking into the epidemiology of Candida auris in Western Australia and, in collaboration with researchers at Fiona Stanley Hospital, faster, more sensitive diagnostic approaches to identify these fungal pathogens. Our molecular approach is shown to be very useful in diagnostics and environmental investigations with a high sensitivity, specificity and importantly a low cost.
The impact of antifungal agents in farming and agriculture is also a significant health issue, and we are looking into increasing drug resistance in Aspergillus isolates due to environmental exposure to fungicides.
We work with both researcher groups within the University of Western Australia and diagnostic services at PathWest to study how more complex eukaryotic pathogens interact with the immune system and how we can importantly improve our current diagnostic measures to help improve treatment and outcomes for patients.
My name is Josephine Muir from the Noisy Guts Project. My team has been seeking to develop a non-invasive and diagnostic test for one of the world's most common gut conditions, irritable bowel syndrome. IBS is a debilitating condition affecting 11% of the world's population and up to 1 in 5 Australians. Currently, diagnosis is a lengthy and costly process, often resulting in an uncomfortable colonoscopy. Our team is seeking to resolve this problem. Initially, we investigated gut sounds as a way of diagnosing IBS. Our current attempt is a digital solution based on gut health symptoms. We're currently conducting a clinical trial at the Marshall Centre to validate our approach to solving this wicked problem.
If you are interested in any of our projects, we will be delighted to hear from you. Please contact us at our contact page.